Hey, it's Jessica DeMassa with WTF Health. What's the future health? I am talking to the who's who of health tech and healthcare innovation live from Health. And here I am with Stephanie Telenius, the CEO of Vida Health. Stephanie, it's so good to finally meet you in person.
It's great to meet you, Jessica. I can't believe when I saw you, I thought we had actually already met.
I know, but no, it just feels that way. It's larger than,
It's actually in person.
No, this is so great. And so I want to check in with you. I've been talking to a bunch of people here, and I just want to get an update on what's going on with Vida. The last time we spoke, you had just raised your last funding round. We had talked about the deal with Centene. We talked about the mental health integration, which you guys have always had, but it really got some great utilization this year. So pick up the story from there for us and give us a quick update. What's going on at Vida?
Well, we're growing and scaling, and as you know, we're living in a pandemic, so mental health has become a huge priority for a lot of people. I would say prior to the pandemic, we saw 1 in 4 or 5 people that had a mental health issue, and now it's 1 in 2. So we really are a side door into mental health, because people will come in for obesity or weight loss or diabetes, and then they realize they have co-occurring depression and anxiety, and they'll get enrolled. And so we're seeing a lot of progress and impact in the reduction of stigma and the acceptance that this is actually really important for people's health, and that you really need to combine the mind and the body to get the best outcomes. And we're seeing amazing outcomes. It's really fulfilling to actually see people transform their lives. Yeah. So they'll reduce their A1C. The A1C is a measure for your level of diabetes.
Thank you.
Yes.
For defining that. I like that.
So you'll reduce your A1C, they'll reduce their weight, and those people that enroll in both diabetes and weight loss and mental health, like co-occurring depression and anxiety, what's amazing is at 6 months, 100% of them will see an 80% reduction in depression and anxiety. 80% reduction in depression and anxiety. So huge impact. Okay. And during this pandemic, it's really important to be doing that. So
yeah, no, that's awesome. Can you say a little bit more about how you're measuring that? Because I always feel that's one of the
that we are very focused on measurement. So we
no, but not every digital health tech startup is.
I think that for decades, well, at least for the last decade, and right now for even the last couple of years as digital health has emerged, the focus has been on access, because we have an access problem, right? We have we totally have an access problem in this country, but we now need to focus on measurement of quality outcomes. And we measure, we've published in JMIR, we measure the PHQ and the GAD. PHQ is a measurement of depression, GAD is a measurement for anxiety, and we measure the reduction. And we just, we do it consistently. So
that's awesome. So I love this, because this has been the thing with mental health. I feel like it's always even in the way it's paid for, it's separated from the rest of everything healthcare. So you have all of healthcare, and then it's mental health care is over here. And I feel like with the pandemic, and tell me what you're thinking, and what you're seeing around this too, but it seems to me like the mental health is starting to come back into healthcare, proper. Do you feel the same way?
Absolutely. Everyone's realizing you have to treat the mind and the body together, which is what we do.
Always from the beginning.
From the beginning, we've been doing that. And I think there's a recognition of the impact of mental health on people's physical health and their productivity at work, and with it's just been heightened by the pandemic, and many employers and payers. So the employers are looking to add services to provide mental health access and value, and then payers are now saying, well, actually, we really need to have a network of mental health providers. Okay. And so we went in network with Blue Cross Blue Shield of Illinois. Awesome. So they're looking for mental health coaching and therapy services as well.
That's awesome. Well, there seems to be a shortage of that. I mean, it's and there's a shortage of clinicians all over the place, but particularly in mental health. So that's awesome that you guys are doing that. I wanted to ask you about the Spanish language version of Vida, because that was another thing that was new the last time I talked to you too. So talk to me about that. How is that going out? Because I'm really curious about that particular population of patient. And when it comes to mental health, there's not a lot out there in Spanish.
It has been so exciting to see the progress, because we have an 87 so we have an 80 NPS overall for our company, for our service, but we have an 87 NPS for Spanish, because they're so thrilled to be able to get the product and the service, and the engagement has been unbelievable, and the outcomes have been amazing. And so we're able to serve different segments of the population, and during this time it feels really fulfilling to be able to do that. Yeah. So we're gonna see more and more Spanish growth.
That's really cool. Will you add on to that then within Vida?
We're looking at where are the populations that we need to serve. So.
Right. How are things going with Centene? Can you give us any update there?
Things are going well. We're now, I think, in 25 states with them. So we've expanded, and we're growing and getting outcomes, and so it's really good.
All right. What are you seeing, in terms of I feel like the health equity conversation has been a big thing that I've been hearing a lot here at Health. I mean, also before it, but it's that's one of those things. And also going at risk. So it's talk to me, let's start with the health equity side of this and let's talk about at-risk models, because I understand that there's some kind of new news there. But before we get to that, on the conversation of Centene, talk to me a little bit about the health equity side of things, and more than just the improving access piece of it, the improving outcomes part of it. But what are you focused on as the CEO of Vida and working with a company like Centene in terms of reaching, that market?
We're looking across, so we serve employers and payers, and we're really trying to make sure that we have a diverse population that we're serving. And you have to look at fully insured, and then commercial, and then Medicare and Medicaid. And so we have customers across all of those except for Medicaid. Well, actually, we launched with Humana in Kentucky for Medicaid.
Awesome.
So we are serving all those segments, and it is really important to have the ability to meet, we have a platform that goes across those segments, and you have to factor in where the person is coming from, what are their social determinants. What's the best way to help them?
Right.
What kind of coach or therapist should we give them? And it has to map to their background and their understanding, and you really have to meet the person where they're at. So we're spending a lot of time trying to figure that out. Yeah.
I feel like there's a lot of people who are doing that, but I think that that time being spent trying to figure it out is more time than previously.
Yes, I think that's right.
Okay, good. All right, good. I'm glad that we're trend checking with you and that we are on the same place there. All right, so talk to me about this at-risk model, because I feel like I keep hearing that over and over again as well. And you guys had been at risk always on the physical side of things, but I understand you guys have extended that into the mental health piece, which is very unusual, is what I've been hearing.
Yeah, we really wanted to put our money where our mouth is, and we've always been a company that prides ourselves on outcomes, and we're seeing such strong outcomes between mind and body together, and we said, well, why not have a package that is 100% fees at risk that covers the mind and the body and covers outcomes across the spectrum. And that way we're really thinking about aligning with the healthcare system and looking at, it's all about the triple aim, and so just really trying to make sure that we're aligned with everyone else, and that we're putting our money where our patients, because our North Star is outcomes. So we want to deliver on that, and we've seen the data. So the data was, we've gotten bigger and seen more data, and it's more compelling. And we think the whole industry is moving in this direction, and we believe in value-based care, and we think the whole industry should move there as fast as they can. It's better for patients, it's better for providers, it's better for insurance companies, employers, everybody around. It's a win-win. So we wanted to start that trend with mind and body together and 100% fees at risk.
All right. So, what are some of the? This is going to be a tough question, and in the sense of this, what is the thing that is causing you the most friction at this point with that? You know what I mean? Is you're looking at the data that you're collecting, you're looking at rolling this out, and we've often heard in other situations value-based care is so hard to scale. What is the particular piece of friction that Stephanie Telenius is working on right now?
It takes a lot of work, right?
Yeah.
You have to provide the care and do a really good job at that, and then you have to measure the outcomes, and you have to set the infrastructure up to actually look at all the different pieces. So you're looking at outcomes across a wide spectrum. You're doing actuarial analysis. You have to have the medical foundation. We're a medical corporation in 50 states, so it does take a lot of investment. And I think you're seeing a lot of the companies that are succeeding, and I haven't been to, what I'm hearing as a theme at Health.
Yes. Tell us the gossip you're hearing.
It's just that everyone who's investing in value-based care and end-to-end care is really changing healthcare, and that's the talk right now.
Right.
We did this independent. We didn't know that was going to be a theme here.
We lucked out.
but it just so happens that everybody's talking about the same thing, and because they're feeling the pressure from the market, right? So.
No, absolutely. I was going to ask you too, what else are you hearing from you obviously are in the room talking to, leaders in health plans, leaders in health systems, self-insured employers. What's the sense of what's going on with them? Because I feel everybody keeps talking about, especially on the employer side, through the ringer this year. It's Great Resignation, all the other stuff. How are they when it comes to healthcare in this I hate to say it's not post-COVID, because COVID is still very real and happening, but post-surge, vaccines rolling out. How are they faring when it comes to thinking about healthcare? What can you tell us about some of those insider conversations you might be having?
Just from my perspective, I think what the real shift that's happened is that people in the employment world now realize they have to do right by their employees in healthcare. Like it is, instead of snacks or transportation or other benefits, it's about healthcare, and it's in particular it's about providing the best access and value-based care, and mental health is top priority.
Yeah.
And everyone's saying, I know that I need to have this this service for my employees to improve productivity, to improve health, and then the thing that's particularly right now with the pandemic, and well, not ending, but like in a manageable place, let's say.
Yeah.
Like,
Yeah, I'm in the same boat with you. Yeah.
So it's manageable, and people are starting to go back to work. Is this, how do we manage in a remote hybrid environment?
Okay.
How do we have connectivity and belonging, a sense of belonging, and how do we optimize the health and the body and mind and the productivity of the employee so they can have the best life that they can lead and contribute to the company? So it's a win-win. Okay. And so now healthcare services are like front and center as a way to provide that.
That's awesome.
Whereas before it was like, what cool snacks or transportation.
Yeah, no, I totally get that. I think that's really cool that they've kind of shifted their mindset that way. And so it's like healthcare is kind of having a moment for them.
Having a moment.
That's awesome. I love that. Okay, what about with the payers and the providers? Like, I'm curious on your take there. You know, are they still as virtual, digital resistant as they were before the pandemic to you? Or do you feel like, I mean, and everybody's like, oh, toothpaste out of the tube, you can't go back, blah, blah, blah. But it's like, how real is that, Stephanie, from where you're sitting?
We're not going back.
No,
we're not going back. Consumers want it. It's much more convenient. It's a much better product. Continuous virtual care in your phone it just makes much more sense than driving to your doctor all the time. You don't even need to go to some of these in-person visits. You can do so much of it virtually. And what you've seen is in COVID, I think the peak was like 64% of all visits was virtual, and then it went back down. But mental health is staying, and people are realizing this is a better way. Now, you might want to meet someone once in person, like there's this like connection between offline and online.
Yes, I'm feeling that right now.
Right, but I think virtual care is here to stay.
Okay, great. And the health plans are receptive to that? Are they looking at it as like a strategic, like
virtual care first and new models of care? Everyone's embracing it. I don't think we're going back. The genie is out of the bottle.
Oh, genie's out now. Toothpaste out of the tube, genie's out of the bottle. No, it's like I keep hearing it, but it's like I've been hearing it all year. And so it's like that's one of my things here is at Health. I'm trying to figure out like how real is this, or are we like living in like a false like, you know, halo effect of COVID?
No, it's like the internet in 1999.
Oh, you would know.
It's happening and it's not going. It's like cryptocurrency. Let's put it that way.
There you go. All right, it's crypto. You heard it here. We got this. All right, Stephanie, thank you so much for letting me just pick your brain, stopping by. It's so nice to meet you. It's good to get an update on what's going on over there because I know you guys have been heads down working, so it's great to get an update.
Great to meet you in person.
Thank you so much. I'm Jessica DeMassa. For more from the Who's Who of Health Tech, check out my YouTube channel over there at youtube.com/WTF Health. Thanks so much, Stephanie Telenius, the CEO of Vida Health. Nice to meet you.